Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is here in Minneapolis this week for ACCC's 41st National Oncology Conference. For the past 4 decades, ACCC has convened oncology professionals from across the nation to discuss the latest trends and advancements to improve cancer care. NOC has a unique learning focus where professionals are coming to share best practices and replicate award-winning programs. It's something the staff and attendees look forward to each year. We are here with Magbis Nunez Love. She's a community liaison for Atrium Health at the Levine Cancer Institute. Magbis, welcome to Cancer Buzz.
I'm so happy, and thank you, Summer, for having me today.
Magbis, you have a personal connection to your work. Would you like to talk about that?
Yes, I used to work with cancer patients, with Latino cancer patients, and working with cancer transition and other wellness activities. And after working probably for 5 years, I found that I have cancer also. And then navigating, like going through my process, I realized there are many things that we can change and make it different and improve the services that we provide to specific for the Latino patients.
Tell us a little bit where and how you work.
I work in the community. I love to work with churches, schools, and any organization that they already are established good relationship with the Latino community that make everything easier because you just build connections with them and they help you to provide all these services.
You have a session tomorrow entitled Culturally Tailored Patient-Centered Survivorship Care Improves Access and Outcomes. What do you think is the biggest takeaway from your session?
I think that it's important that everyone who works with cancer patients realize that they cannot put everybody in the same bucket. You have to create and design programs based on culture and practices. Everyone is different, you know. Many Latino patients still working during treatment, and we are offering this wellness activity during the day. Some of them, they don't have transportation. They are 30 minutes or 40 minutes away from the center where they are getting treatment. So they have to realize that the programs that we offering to the community or to our patients should be more accessible, affordable to them based on time and everything. And even the gas, transportation, there are many things that they have to accommodate for them. As Latino, we are very social also, very collective, and just create groups, make groups. So that's why I think that you have to design programs to get better outcomes.
What do you hope audiences will do with this information? So what's actionable right now?
I think that one good action will be invite a Latino cancer patient for the patient advocate group or advisory group. I think that would be nice to listen more, build more relationship with the patient. I've been in medical realm when I hear about a Latino patient, they say he's low maintenance. It's not that he's low maintenance, it's you don't know their needs. That's what is important, to establish great and deep relationship to know more about what the patient needs. So when you establish good relationship, you can hear. And so I've been working in this program. I'm navigating them in some way. I know that we have social workers, but many of them, they don't speak the language. They don't know the culture. And I have been sending referrals to some community where they can get, for example, they get some like Nourish Up. Used to be Love and Fishy. Sometimes they are not working and they don't even have food, you know. And sending referrals, supporting them during this time is being a great support for them.
What do the patients say about your approach? Have you heard anything?
Oh, yes. I have many. I can be talking the whole morning about the testimonials. And one of the testimonials that I like to share is one cancer patient get treatment. I remember she was the time when I was receiving my treatment. And after a few months, she completed her treatment. Her husband died, passed away from a heart attack. And then she was being part. She came to our activity. She completed nutrition and all these classes. But just now, 10 years after, 4 months ago, she lost her son in a car accident. So we are providing salsa and bachata classes. And she said, I want to go. And I was super happy when I saw her coming to these classes, and her daughter told me, Magbis, I have my mom here. She wanted to come and say she doesn't want to do anything. Now she came, and I took advantage, and I came with her. And so they were dancing and having fun during the classes. And after we completed the classes, she hugged me and told me, thank you so much for having me, inviting me to this activity. And her daughter told me, it's the first time that I see my mom smiling after my brother passed away. So I'm so happy to come with this type of activity because I know the connection from your emotional state to your physical state.
Right, in survivorship. That's very powerful. Thank you for sharing that with us.
Welcome.
Thank you, Magbis, for joining us. Follow along on this channel for more this week from Minneapolis at the ACCC 41st Annual National Oncology Conference. We'll be back again later today to share more discussions and learning sessions from the conference.
This show is a resource of the Association of Cancer Care Centers.